Hello all, I'm Dr. Neema Bhat, Senior Consultant Hematologist, BMT Physician and Pediatric Oncologist here at Healiuscancerhematology Clinics in Jayanagar, Bangalore. Today I'd like to talk to you about a very relevant hematological topic. If you have heard of a condition called ITP or Thrombocytopenic Purpura, so it's a condition where platelet counts are found to be very low in people. So in blood we have three types of cells: red blood cells, white blood cells and platelets. So each of these type of cells have a different type of function. Out of these, platelets have the function of clotting blood and helping us preventing bleeding, as well as making scars or healing our wounds. So what is ITP? To break it down, it is ImmuneThrombocytopenicPurpura, which means our immune system messes with the way platelets are being produced, as well as causes destruction of platelets, causing the numbers to be very low. Who is ITP seen in? So who are the people in whom ITP is seen? It can be seen in anybody ranging from the age of 1.5, 2 years, all the way up until 90 years of age. So it's a condition that is commonly seen in all ages of people, be it pediatrics or in adults. In fact, it's more common in the pediatric age group, especially in the ages between 3 to 8 years old. What is the incidence? So how common is it? So in kids, it can range between 3 to 12 to 15 kids for every 1 lakh kids. And in adults, it can be as common as 5 to 10 adults per 1 lakh adults are diagnosed with ITP in a year. What are the symptoms of ITP? So how would you know if you have ITP or immune thrombocytopenic purpura? So if you have low platelets, the most common signs or symptoms that you would notice would be very easy bruisability. So if you get hurt or without even knowing, you would have a bruise or a bluish colored patch on your chest, on your arms, on your legs. So we call them non-pressure areas. You would see tiny red colored dots either on your chest or on your face. Sometimes you can have bleeding in the eyes. It can present with bleeding in the nose, bleeding in the gums. Blood can be present in your stools or in the urine. So these are all symptoms of bleeding that can happen because of low platelet counts. Who usually diagnoses ITP and how is it diagnosed? So usually ITP is diagnosed by a hematologist who is nothing but a blood specialist. So it is diagnosed by a series of blood tests where we rule out other causes that can cause low platelet counts. So other reasons that can cause low platelet counts can be some serious conditions like leukemia or blood cancer, lymphoma, that's also another type of blood cancer, other metastatic conditions, so other solid tumors that can spread to the bone marrow and affect the marrow and cause low platelet counts. So we run a series of blood tests to see if there is any iron deficiency, if there is any B12 deficiency, if there is any other reason because of which the platelets are being destroyed. And once all these reasons are ruled out, we also do a small test called bone marrow aspiration biopsy, which is nothing but taking a sample from the factory site where these blood cells are produced. And once we process that, we get to know that these cells are being produced normally, but they're being destroyed because of the hyperactivity of the immune system of the patient. And once the diagnosis is made, it is very important to treat patients with ITP, especially if their platelet counts are less than 50,000. Because as I mentioned earlier, platelets are very important to make sure that bleeding is controlled. So if there is no system or mechanism in place to control bleeding, or that system or mechanism is sort of spoiled or not working well, then it can cause bleeding that can be life-threatening. So somebody with platelet counts less than 50,000 can have bleeding inside the head that can be life-threatening. People can have bleeding in the abdomen that can also be life-threatening. So it's very important to diagnose it at the right time and initiate treatment. Treatment for ITP can be very simple. Once the diagnosis is established, it usually consists of a few tablets, sometimes maybe an injection that is given once a week. Or if it doesn't respond to these initial methods, then a few more complicated medications that we bring on as hematologists that have to be taken over a period of 2 or 3 cycles before this problem is fixed. Do not fear to seek out help for this bleeding problem, especially if you have noticed bruises or petechiae or excessive bleeding or abnormal bleeding in your day-to-day life. That is what a hematologist is here to help out for. Seek out and seek the consultant to establish the right diagnosis. Feel free to reach out to our clinic, Helios Cancer and Hematology Clinics, here on KR Road in Jayanagar, Bangalore. Thank you.